Hi, I'm Dr. Josh with Highlands Wellness, and in this video, I'm going to show you one of my favorite drills for developing range of motion in the hips. I'm not thinking flexion and extension so much as I'm thinking the rotation types of motion that our hips are meant to do. I often see this as an issue with my patients, especially as we get older. All right, so the goal with this exercise isn't so much to be super strict and technical. It's more so just to get more comfortable moving in a wider ranges of motion. So initially, we're going to start in a 90-90 position as best we can. Try and keep both knees on the ground. Try and make yourself tall. You can put your arms around your chest if you need to, or you can have an arm on the ground to support yourself. Especially at the start, this alone can be a really challenging stretch. So spend some time here, breathe, get comfortable. Try and move in your upper body without having your hands on the ground. Try and make yourself tall. Fold in half. Try and fold over the other leg. See, my knee lifted. So try and keep that knee down and then fold over the other leg. It's quite challenging. From here, well, you could just spend some time watching TV doing this if you wanted. That's a really good start. But from here, we can start to create different exercises that really are just playing with this position. So I can bring this leg around, which is quite challenging. Rock to the other hip and drop this leg. And that's an excellent way to engage the little muscles on the sides of the hip. And then back this way. Awesome little exercise. I frequently will use this as a warm-up any of my gym days, just to get things moving, or I'll plug it in between other exercises that I'm already doing. The other one we can do is bring both knees up, drop, then come here, drop, and you're almost doing a little scoot as you just try and create some blood flow and a bit of a stretch on either side of the hip. I'm not so good at some of these variations myself. I find them really challenging, which is usually a sign that I need to do them more. But if you're a bit more advanced, so maybe like I see this sometimes with my gymnasts, my dancers, some of the people I treat who do yoga, they're better at this than I am. We'll start to do contract and relax out of this position. So we'll get nice and tall here, and then I'll tell them to push this knee down. So they're squeezing that knee into the ground. All these muscles will turn on and start working, and then we'll get them to relax the knee and now start to rotate this ankle up. So rotate that ankle up, and all these muscles will be working. So knee down, knee down, knee down, relax, ankle up, push, 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 breathe, 3 to 5 seconds per set, and then relax. Really challenging, really engages these muscles here. The other one I like is similar to what I just showed you with the rocking side to side, bringing the knees around, but just slowing everything down. So bringing this up, 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 all the way through, and then bringing it all the way back under control as best as we can. Really challenging variations. From there, if you can conquer all of those, you can just spend more time doing this. You can do longer contractions. You can even attach a band up high and give yourself some resistance. Lots of things you can do with this. I've had patients hold a little weight and do some rotation on it. I've had patients come from this position and then rock up and then drop down, rock up and drop down. So really, no real wrong way of using these. Be careful when you start though, because they are really challenging, but there's a lot of room for growth out of this position, and it does tend to carry over really nicely to helping with hip pain and low back pain, but also mobility for things like deadlifts and squats and lunges. I find them really helpful. If you have any questions, let me know.